Well, on to this now. The Treatment Action Campaign has used World AIDS Day to highlight the fact that there's still a long way to go before HIV can be completely eradicated. Campaign chairperson Sibongile Chabalala says of the 7.8 million people who are HIV positive in South Africa, only 4 million are currently on antiretroviral treatment.
Remember, we said test and treat, but over 7.8 million that are living with HIV, only 4 million that are on treatment. We are still looking to put another 3 million people, more than 3 million people on treatment. So that means we are not yet there, and we have a long way to go in order for us to reach the goals of 1990 and to end AIDS. By 2030, we want to reach that goal by the look of things, the way things are today, and the challenges that we are facing.
While still on World AIDS Day, despite having the world's largest ARV program with free treatment available to all, recent statistics show that South Africa's HIV infection rate is rising. The COVID-19 pandemic has also resulted in a lower number of people, that is, being able to access testing and treatment. To address this, South African digital health startup Aviro has launched a new service to transform the way in which patients interact with healthcare providers. I'm joined now by Aviro Health CEO, Dr. Musaed Abrahams. Dr. Abrahams, good evening to you, and thank you for your time. Firstly, I mean, when we think about the fact that South Africa has the biggest treatment program in the world when it comes to HIV, and yet we still have such a significant number of people who need this life-saving treatment and are not on it, it really paints a picture about the kind of challenges with access that we're facing.
Good evening, Kathy, and good evening, listeners. Yes, so the challenge with access comes with the challenge with access to testing and then access to linking those positives that are testing to starting ARVs. I think there are numerous reasons why it's still difficult to get our testing numbers up, but we were getting to our testing targets before COVID. However, since COVID, there's been a big drop. Some people say about 22% drop in people accessing testing services, and also about 12% drop in people accessing prevention services. So, you know, there are many reasons for it. Some of it is still that there's still stigma around HIV, but other parts of it is actually just on a practical level. People don't have access to timely testing and to convenient testing.
Are we able to say yet, and I imagine an organization like yours would be well in the know, are we able to say what the impact of the pandemic in as far as those disruptions that it created for people being able to access healthcare services, sometimes even being able to access their medication, the kind of impact that that disruption has had, and if there are long-term effects that have stemmed out of that?
Yeah. I think so. As I mentioned before, we do know the stats in terms of the testing numbers being dropped and also the numbers of patients accessing the ARVs. The long-term effects are still to be found. Just on a normal amount, though, if your testing numbers have decreased by 22%, that means a lot more people actually, you know, have HIV and continue to transmit the virus as well.
Let's talk about your tool and how it can be a solution to this problem.
Yeah. So with the Aviro Pocket Clinic, which we're launching today, we have been working on this for the last 3 years. We have been piloting the system in terms of supporting patients around HIV self-testing. So that means patients getting an HIV self-test kit, whether taking it home, whether getting it at a community distribution, or whether testing outside in a booth facility. These are the 3 models that we have been working on in the last 3 years. We've had about 30,000 patients going through Pocket Clinic, and the results so far have been extremely good. So for instance, KZN, where we have rolled out in about 28 clinics, we see that the testing numbers, the amount of patients the amount of positives that we're getting is 7.5%, which is much higher, almost double the amount in those clinics that are not using Pocket Clinic. So we feel that because we're making a digital avenue more accessible to some patients, even if it's outside of the facility, that more patients are coming to test and we're finding more positives.
Does that mean, sorry, Dr. Abrahams, does that mean that you find people are responding to the level of convenience that technology provides? And so what are the processes that one would follow on the digital platform that they would not necessarily have to follow when they are visiting their local clinic?
So I think the primary service that we're providing is we're taking counseling out of the facility, where patients first have to wait for a folder, they'd have to wait in long waiting lines for that counselor, and then speaking to a counselor. And we know actually that a lot of patients feel stigmatized and don't want to speak to a counselor directly. What we're offering in the digital tool, whether you access it on the WhatsApp chatbot or whether you access it at the facility on a tablet base, is a impersonal way to actually get the right information in the right time for you, and then linking you to care or linking you to the counselor if you need it. So I feel like counselors are very important, and they are, but they should be there not to deal with the large amount of numbers that we have to get through for the testing. They have to deal with cases that requires, in-person support. So patients would go through the counseling, watch the counseling videos. Those counseling videos were made in partnership with the National Department of Health, and they have endorsed the application as well. So they're getting good information at the right time, and the feedback has been really good in terms of 90% of the feedback that we get through the application is that it's easy to use. They find it credible, and they would refer to other people. So we're quite proud of the work that we've already done with those 30,000 patients. And now with the new platform, we're looking to scale up to more clinics and to more users.
How much of this says to you that there is still a significant amount of stigma that is attached to HIV, and especially people who fear they may test positive or even who end up testing positive? The fact that people prefer to walk this journey almost alone through the assistance of a digital tool than having a warm body.
Yes, I think that is, we've come from a sort of a large historical background where that stigma and that fear has sort of set in, and I think sometimes solidified. A lot of the patients actually know the information that they need to know around HIV, but there's still a lot of stigma and fear about what people would think if they were themselves diagnosed with with HIV, and then there's a certain amount of fear of the unknown, of what are the steps to take if they are positive, and what are the steps to take that we're now negative. And I think by combating that with the right information at the right time, but also there's a fair amount of emotional component in the digital video counseling service itself that actually speaks to drivers of more positive behavior. So I'm testing because I want to look after my body. I'm testing because I want to be healthy for work and to be able to look after my family. Those are also the type of messagings that we've decided to include in the counseling syllabus, especially because a lot of males don't want to test. And so we're trying to drive, yes, we're going to give you HIV information, but we're also going to address the emotional component and trying to decrease the stigma and the fear around testing and around diagnosis.
Dr. Abrahams, very quickly, how soon before it's available to everyone else in the country?
So at the moment, it's free to our end users, but we're partnering with certain NGOs and certain private institutions to provide the service free of charge. So as those NGOs partner, as we have more NGOs partnering, you will see Pocket Clinic in hopefully every clinic in the country.
Aviro Health CEO, Dr. Musaed Abrahams, let me thank you for your time tonight.